Another category of anti-hypoglycemics is a category called the amylin analogs. And along with the incretin mimetics, these are covered in the table on page 317. Our prototype drug is pramlintide or Simlin. It's also given subcutaneously. It prevents hyperglycemia by slowing down the stomach as it empties and making the patient feel fuller for longer. Once again, GI side effects: nausea, vomiting, abdominal pain. This also can increase weight loss, and but the person might also feel tired and have a headache too. Biggest adverse effect, hypoglycemia, can be severe. Doesn't mix well with aspirins, atropine, which is our prototype anticholinergic, disopyramide, fluoxetine, pentoxifylline, other drugs for blood pressure and cholesterol, and of course the MAO inhibitors, because naturally. So this particular category of drug, if the person has this ordered, you'd probably want to sit down with them, look at what they're already taking, and make sure you let them know what this side effect could be. As a nurse, you want to make sure that you warm the injection to room temperature so that it doesn't really sting, and rotate injection sites, just like we're told to do with insulin or any kind of sub-Q medication. You don't want to inject it in the same place. The next category of drugs, you want to flip over to page 319 in your book, and you've got the table, and then the text talks about it on page 318. The DPP4 inhibitors. DPP4 is an enzyme. The enzyme inactivates the incretins. Now you remember, incretins are the good guys. That's a hormone. You want that. But the DPP4 will inhibit them. It will inactivate incretins so they don't work. So what we want to do is turn around and inactivate the DPP4. So therefore we're inhibiting it. Our prototype drug for this is sitagliptin. Oh my gosh, some of these drugs. Sitagliptin or Januvia. We'll just call it Januvia. It's pretty common. You've probably heard it. Januvia is a real common drug. It's a PO med. And in some places, they combine Januvia and metformin. So you get the enzyme inhibition, but you also get all the benefits of metformin. So they call that Janumet. And it's just a DPP4 with a biguanide. So if you can inhibit that enzyme DPP4, then you're going to have more incretins at your body's disposal to encourage insulin production. For some reason, one of the side effects of this is similar to an upper respiratory infection. You can get a cough, you sneeze, you have a runny nose. That's kind of weird because usually it's GI side effects, but in this case you feel like you're getting a cold. The most severe adverse effects can be diarrhea and, once again, hypoglycemia. They don't interact well with antifungals and antibiotics, especially erythromycin and ketoconazole. The biggest thing to watch out for besides hypoglycemia is possible pancreatitis. Because, once again, you're kind of working in the GI tract to inhibit this enzyme. So you want to look for abdominal pain, nausea and vomiting, other signs that maybe the pancreas is not coping very well with this medication. One important thing, because of possible effect on the kidneys, is to get a creatinine clearance. You want to do one of those 24-hour urines. Make sure that there are normal levels of creatinine before you start Januvia, just to make sure the kidneys are going to cope okay with it. Now, this is a new category of drugs on the market. And the key does talk about them on page 319. They were approved in 2013. And the first drug that came out was canagliflozin, or Invokana. And these are still being advertised on TV. So, you know, the pharmaceutical companies are still making money off of them. This category is called the sodium glucose cotransporter 2 inhibitor. So SGLT2 inhibitor. So this inhibits this particular substance that will take up sugar out of the urine and return it to the bloodstream. Now, it used to be if you had sugar in your urine, that was a sign that you were spilling too much. And you usually would see that with uncontrolled diabetes. And that used to be a test. You'd do a dipstick in your urine, and if you saw sugar in it, you needed to change something that you were doing. That was kind of a primitive test before we had the HbA1c and before we really had these good little glucometers that were so sensitive. People would have to urinate. They'd have to, initially you had to boil it and do all this stuff, put some substance in it. Now then you just had to dip it. But it was not a good sign to see sugar in your urine. Well, now with these drugs, you're going to see sugar in your urine because these drugs block the reabsorption of glucose from the kidney. So when the kidney is making urine and returning some substances to the bloodstream and sending some out with the urine, usually it's going to take up the glucose and send it all to the bloodstream. In this case, it doesn't. It sends it out in the urine. So if it's leaving in the urine, the glucose is not going to be available in the bloodstream to increase your blood glucose levels. So that's how it gets them lower. So, you know, back in my day when I learned, you know, it's a bad thing to have glucose in your urine, now we've got meds that make you have glucose in your urine. So that kind of, you know, changed the whole game plan. This was a very thoroughly resourced medication. They did 9 clinical trials. They tested over 10,000 type 2 diabetics and found that it was a really pretty effective way of lowering blood glucose. It improved your HbA1c levels. It improved people's fasting blood glucoses just by making the kidneys get rid of sugar from the bloodstream. And I got that from the FDA site. There's some other types that you probably hear them advertising on TV. Farxiga, I've heard of that, and then Jardiance. And they all make you get rid of sugar through your urine. So they're pretty effective.